Hello mamas and welcome back to the Pregnancy with Physio Laura podcast. Today we are kicking off with episode 4 in the Pregnancy Nutrition series, discussing all about the topic of gestational diabetes. Now this is episode 4 of our 5-part Pregnancy Nutrition series with the wonderful Larissa Telfer, who is an accredited practicing dietitian and diabetes educator. Don't forget we have already released the first 3 episodes in this series, which cover the specific nutrients needed for each individual trimester of pregnancy, safe fish and caffeine consumption, what foods to avoid during pregnancy cravings, and healthy gestational weight gain. So make sure you go and have a listen to all of those episodes before you dive into today's. Now, let's get into episode 4 of our 5-part pregnancy nutrition series. You are going to love today's chat with Larissa as we jump into the ins and outs of gestational diabetes. Enjoy. A really common thing, or not super common, but I'd actually love to know the stats on it. Gestational diabetes. So we know that probably you'll know someone that has it if you don't have it yourself, but it is something that I see a lot of women managing these days, but who don't really understand much about it or how to manage it very well. Unfortunately, there's a lot of support within the hospital system, it seems, these days. But could you give us the down low on what is gestational diabetes and why women may get it during their pregnancy?
Yeah. This is kind of my jam, so to speak. So I'm also a diabetes educator. So I'm working with women with gestational diabetes every week and I've seen hundreds of women go through with gestational diabetes. So, and it is becoming more and more common. So I think the latest stats are that it impacts around 10% of pregnancies in Australia. So It's not uncommon. Most people have known of someone that's had gestational diabetes. People aren't often aware of it or that they're at risk of it until it happens. So the reason gestational diabetes occurs is it is driven by the growth hormones that the placenta is producing in pregnancy. So these growth hormones trigger or lead to something that we call insulin resistance, which is when our body doesn't, utilise the insulin that our pancreas is producing as effectively. So in a normal pregnancy, our body's actually requiring 2 to 3 times more insulin by the 3rd trimester than when we're not pregnant. And interestingly, once the placenta's out, those insulin requirements just drop straight back down to what they are when you're not pregnant. So it's really quite impressive the impact those growth hormones have that the placenta is producing on how our body uses insulin and how much insulin we're needing.
That's amazing.
We're needing insulin to help regulate our blood sugar levels during pregnancy. And if for some women they're not able to produce enough insulin to counteract that resistance, and they therefore end up with higher blood sugar levels, and this is when we tend to see gestational diabetes diagnosed. So there is a few, risks associated for women with gestational diabetes, but I always like to emphasise that if we manage the gestational diabetes and we maintain those blood sugar levels, what we're aiming for in that healthy range, the risk of those things happening is reduced. So some of those risks, and I think the most common one is having a large baby. So I think that's one of the most common things when people think of gestational diabetes, it means you're going to have a large baby. And the reason for this is our blood glucose levels during pregnancy, our baby's actually exposed to those blood glucose levels throughout the pregnancy. So if the baby's sitting in a little environment with lots of glucose floating around in the bloodstream, it goes, oh, beauty, there's lots more energy here. I'm going to put down more fat in preparation for after I'm born. And they then leads to high birth weight babies, or you sometimes hear this referred to as macrosomia. And as you know, having, a high birth weight baby can lead to difficulties in birth as well. So, and also a higher likelihood of having a cesarean section as well.
And is there something about the baby's blood sugar levels after birth as well that can be problematic?
That's correct, yeah. So it's often a bit confusing, actually. So babies that are born to mums with gestational diabetes are actually at risk of low blood sugar levels after birth, which is different because in pregnancy it's the high blood sugar levels that cause the issues. And the reason for this is when the baby's sitting inside the womb, if it's experiencing high blood sugar levels, its little pancreas actually produces more insulin. And then after it comes out into the world, it's got more insulin floating around in its bloodstream without that high blood glucose environment, which means it's then at risk of low blood sugar levels, or we call this hypoglycemia.
That makes a lot of sense. And I know that's why it's recommended for women, if they can, to antenatally express some colostrum in case their baby does have issues with low blood sugar after birth. But like you were saying, going back to what you were saying at the start, this does not mean if you have gestational diabetes, these things will happen, because if you do control it well, you should be mitigating the risk of this all happening, correct?
Absolutely.
Yes, but it's just something to be mindful of, and that's, I guess, the motivation to make sure that your gestational diabetes is managed really well, because these are the risks on the other side. So how would a woman know she has gestational diabetes? What is the testing procedures these days in Australia?
Yeah, so in Australia, the, I guess, gold standard for diagnosis of gestational diabetes is an oral glucose tolerance test, which is that horrible glucose drink that no woman enjoys having. And there's actually 3 blood sugar levels that are completed as part of that. So there's one fasting before you've had that glucose load, and then 1 hour and 2 hours after that glucose load.
And what stage is that usually done at? What gestation?
Yeah, routine sort of 26 to 28 weeks. For women who are at higher risk of gestational diabetes, they will often have an oral glucose tolerance test earlier in their pregnancy. And so I think it's good to actually go over some of those risk factors and who actually is at risk, because I find many women that don't actually realise that they're at higher risk of gestational diabetes until they are pregnant.
Yeah, let's talk about that.
Yeah. So there is quite a few risk factors for why some women are more prone to gestational diabetes. Some of them are age. So as women get older, they are more risk of getting gestational diabetes, particularly over the age of 40. And this is just because the pancreas isn't quite as, I guess, able to keep up with that insulin resistance or produce that insulin to counteract that resistance in pregnancy. Certain ethnic backgrounds, we know that people from Polynesian, Indian, Middle East and Asian backgrounds are all more likely to have gestational diabetes. People that have a family history of type 2 diabetes, either a sibling or a parent, or I also find like women who might have a sister that's had gestational diabetes as well, or mum had gestational diabetes, are also more likely to have gestational diabetes. Those that are, I guess, overweight or have a high body weight prior to pregnancy, but also excessive weight gain in earlier stages of pregnancy can also increase risk of gestational diabetes. Polycystic ovarian syndrome, this is associated with increased insulin resistance. So then we go, we're starting off baseline with more insulin resistance, and then we go into pregnancy, which then has a higher level of insulin resistance. Again, this can increase the risk of these women getting gestational diabetes. And some medications. So the main group of things like steroids and some antipsychotic medications also increase a woman's risk of getting gestational diabetes. Yeah.
And let's say you are someone that knows you are at higher risk of getting gestational diabetes. Is there anything you can do as such to prevent getting it, or is it more just being really conscious of managing it well if you do end up with it?
There is some things you can do with your lifestyle, and like we talked about, trying to aim for a healthy weight gain in pregnancy to help reduce the risk. However, a lot of women I see that have these risk factors, particularly if they've got 2 or 3 of these risk factors together, it is tricky to completely mitigate that risk. Yeah. So, but certainly I find, and this is what I often explain to women, there's lots of things we don't have control of in pregnancy. So, your family history, the hormone levels, all those things that the placenta's doing, you don't have control over. But in terms of your lifestyle, what you're eating and your activity levels are things you do have control over. So try and focus on those things you can control, because these will help with managing your gestational diabetes and also potentially reducing your risk of developing diabetes in pregnancy. Yeah.
I certainly know I've had a couple of women who are like super fit, super healthy, just not the type of person, just, looking, they're not overweight, they're not of those ethnicities you mentioned, they've no family history, and they come in so upset because they've just been diagnosed with gestational diabetes. And I always try to remind them, like, it's not your fault. Like, these things happen. It doesn't mean that, you did something wrong. It's just, you're in the small proportion of women that got GDM, and there's all these things you can do to manage. So let's say someone does come to see you, they're 28 weeks pregnant, they've just been diagnosed after their testing. And also, side note, for that test, because I wasted a whole heap of time, I went in there, fasted, sculled it because I thought that would be a fantastic idea, threw it all up because I had it far too fast, and then you can't take the test. You have to come back on another day. So my hot tip for that would be sip it very slowly. Do not scull your glucose drink because you may throw it all back up.
Yeah, and if you're concerned that might be an issue, talk to your doctor before you're having it, because you can take a medication to help make sure you actually keep it down. So if you've been quite unwell or you're really prone to vomiting, that's another good tip as well to mention that to the doctors. Yeah, because it's not much fun if you vomit it and then you've got to go back and do it a week later.
No, and it's just such a waste of time. When you've fasted, you've gone to all this effort to take time off work.
Horrible, and
I tried to reason with the lady. I said, I only vomited a little bit.
Was only a small vomit?
And she's like, it doesn't matter. Any vomit, it's null and void. You can't take the test now. I was so upset.
It's not a pleasant thing at all, no.
So let's say you have been diagnosed with gestational diabetes, and I understand that this may be highly individual. What's like the general management plan for a woman with diabetes?
Yeah, so after you're diagnosed with gestational diabetes, you'll generally be referred into sort of, we call it a diabetes team. So it will involve seeing generally an endocrinologist who's a diabetes specialist, a diabetes educator, and a dietitian. So I guess the key things that will, the first starting point is generally monitoring blood sugar levels. So women with gestational diabetes, we generally get them to monitor their blood sugar levels 4 times a day. So first thing in the morning, and then either 1 or 2 hours after their 3 main meals. And this just gives us a good picture of what the blood sugar levels are doing, and it also allows us to monitor them as pregnancy progresses as well.
And is that a finger prick?
It is, yeah. So like a little finger prick and a BGL monitor with your strips. And you generally need to do that 4 times a day, and most of the time till the end of pregnancy. I guess the insulin requirements and blood glucose levels actually continue to increase and change after you've been diagnosed with gestational diabetes. So we do need to really make sure we're monitoring those blood sugar levels as each week of the pregnancy progresses, because we know that those growth hormones continue to increase. So we need to see what the impact is on those blood sugar levels. And then in terms of, I guess, lifestyle and food and eating, a lot of the recommendations are, based on healthy eating, and we want to aim for a steady intake of carbohydrates throughout the day, regular meals and snacks to help stabilise the blood sugar levels throughout the day. Many women with gestational diabetes will get them to monitor their portions of carbohydrate as well, to help them, I guess, make sure they are spreading that carbohydrate load across their meals and snacks throughout the day, but also making sure they're still getting enough nutrition for the pregnancy as well. So the actual amount of carb and how that looks is quite different from person to person, and that's why it's pretty routine to see a dietitian as part of gestational diabetes to go over that.
Yes, definitely. And that would be plan A, is lifestyle management. And actually, while we're here, could we touch on, we know that exercise is an important part of managing your diabetes. Could you explain how exercise and insulin work and why exercise is so important?
So we know exercise is really effective at counteracting that insulin resistance. So after exercise, it actually improves how our body utilises the insulin that our pancreas is producing. It actually improves the insulin sensitivity.
Okay.
And I find that it can make a really big difference. Like, so for example, if someone has quite a large lunch, they've got a special occasion on or something, if you can get out for even like a 20-minute walk in that time before you're then doing that check, it really improves how your body utilizes that insulin and uses up some of that energy from that large meal you've had, and makes quite a big difference in terms of the blood glucose levels when you then go to do that check 2 hours down the track. It is a really important aspect of that gestational diabetes management. Yeah.
Yes, definitely. And I know a lot of my Pregnancy Posse members sign up to the program because the workouts, they're 10 to 15 minutes long, and they are really effective at helping to stabilize those levels in conjunction, with a really healthy, stable diet as well. So that's great to know. So you're managing your diet and you're exercising well and you're checking your blood sugars regularly to make sure you're on track. So let's say, if that's working, you would just continue like that throughout the rest of your pregnancy, I imagine. Is that right?
That's correct, yeah.
And if it's not working, what's like plan B and plan C for women?
So plan B, if we're not able to get those blood sugar levels in the ranges that we're looking for pregnancy, is medication. Most of the time this will involve insulin, which is an injection, which a lot of people are quite scared about, the thought of having to do an insulin injection. And there is also a tablet medication called metformin that can be used as well in some instances, but certainly the gold standard is insulin. And I think that the thing that's important to get across with insulin is a lot of people visualize like a syringe and a vial and, having to give themselves a really big syringe of insulin. But the devices that we do use for insulin injections in pregnancy are quite small. The needles are very fine, and the majority of women come back to us and say that it hurts less than actually doing their finger prick. So it's not, the majority of women certainly find it not as overwhelming as what their initial impression is. And that's a discussion with your team as well, and your medical doctors and things like that if you get to that point. But it's certainly not uncommon that women will require some insulin injections just to top up their own body's insulin. Yeah,
that's really good. And obviously you're working a lot with women with diabetes. I'm curious to know, what seems to be the thing that confuses people the most? What's sort of the biggest barrier or challenge women tend to have around managing their own diabetes? Do you find there's a common theme?
In terms of food and eating, I think probably one of the most common misconceptions with diabetes is that it's only sweet foods or sugary foods that actually impact the blood sugar levels. But it's actually your total overall carbohydrate intake that impacts your blood sugar levels. The amount of carbohydrate and also the quality of carbohydrate really does have quite a big impact on what your blood sugar levels do after that. So I know that when I work through this with women and we go through, what sort of foods we suggest and some guidance on portions that's best for them, they're often really surprised once they start looking at labels or foods that they'd thought potentially were really healthy, and they're surprised to see the impact that those foods actually do have on their blood sugar levels. So have you
got some good examples of like maybe just one or two things that tend to catch people out, like that are higher in carbs than they probably realize?
One of the ones I think that is common is like things like granolas. So granola's really healthy, but a lot of them, particularly some of the commercial ones, are baked with like lots of honey and maple syrup, and they're quite sweet. And when you put that on top of other carbohydrate foods, that you have that with like some banana and yogurt, and then you have the granola, and you put all those sources of carb together, it actually can end up being quite a large carbohydrate load in one hit. That's probably one of the most common ones that I find that we're working through. That's
really interesting, and that's probably a really good point, because when you hear granola, I think most of us associate it with being a healthier food, than Cocoa Pops. But sometimes there are a lot of hidden carbs and sweetness in these products that we do need to be mindful of. I was just thinking about a woman I used to work with who had type 1 diabetes. And I don't know if this is a myth. This is why I thought I would bust it out. Is it true that if you have sugary food but it's combined with fatty content, that it doesn't spike your blood sugars as much as those without the fat content?
Yes, that's actually correct.
Okay.
So protein has the same impact with your carbohydrate food. Often with gestational diabetes, I'm talking to women about making sure they're having a good source of protein at their main meals as well with their carbohydrate, because that actually helps to stabilize the blood sugar level response after that meal.
Yeah,
So
really interesting.
a common meal I find is like lunch. Like a lot of people will have, maybe some rice crackers or a sandwich or something sort of, carb on the go type meal that doesn't always have a good source of protein with it. And if you can include a source of protein with that, it actually really helps to stabilize your blood sugar levels through the afternoon. Yeah.
Yeah, that's really interesting. I never
Mm.
knew if it was one of those things that people were just making up or whether it was a legitimate fact, but that's really
Yeah.
good.
Yeah.
Oh,
Yeah.
that's really, again, I think you have a really clear way of obviously this is your bread and butter, but of discussing GDM and helping women to really then like, okay, I've got this. Because I can see how it would be very overwhelming and confusing and never know what you can put into your mouth and what you can't. So I think that's a really good summary. And again, exercise and healthy eating is plan A. So it doesn't necessarily mean you have to start jabbing yourself with insulin. That's like if things don't work out down the track. Hey mamas, Laura here. I really hoped you loved that episode. I always found the concept of sugars and insulin and how this whole mechanism works inside a pregnant body to be very confusing. So I hope that today helped you understand more about exactly what gestational diabetes is and the current best management practices for it. If you'd like to learn more from Larissa, you can find her on Instagram at prenatal_dietitian. And I'd also love to hear from you over on my socials at Physio Laura if you've had gestational diabetes before. And let me know your favorite learnings from this episode. In the last episode of this pregnancy nutrition series, we will be chatting with Larissa about fuel and snack ideas for labor and postpartum nutrition. I will catch you soon for episode 5, the final episode in this 5-part pregnancy nutrition series, where we'll be covering snack ideas for labour and the best nutrition guidelines for your postpartum healing. Until then, mamas, sending you wonderful pregnancy vibes and enjoy the incredible journey that is pregnancy.